With the calls by authorities mounting for the increased and intensified patrol of borders in an effort to prevent the increasing influx of imported COVID-19 cases from neighboring Brazil, Regional Health Officer Dr. Niall Uthma opined that it would be practically impossible to do so.
No, that is not possible unless you have moved probably half of the force to Region 9. Region 9, and I keep emphasizing this, has 1,100 miles of border with Brazil. That is practically impossible to monitor. So that is the reality, and it's one that we have to deal with.
As of Tuesday, there was a total of 41 cases of the coronavirus in the Upper Takatu, Upper Essequibo region, with 36 still active. All 19 of the new cases which were recorded on Monday came from Region 9. The region's first case was recorded in May. According to a statement from the regional health officer, the cases was recorded in Lethem, Cater, Waweta, Anai, Arnaputa, Quiko, and Patarna. In a phone interview with this newscast on Tuesday, Dr. Uthma stated that the region has implemented an intensified system of testing and contact tracing in response to the upsurge in cases. New samples are to be sent to Georgetown on Friday for testing.
What's happening in Region 9 at this point in time is a lot of contact tracing, and I believe we've passed the stage for all of the measures that were in place since February, March, April, all of those. Those measures have not changed. We're intensifying testing and contact tracing.
The RHO stated that residents are, I quote, fed up with the new norm, health restrictions, and as such, have not been observing the guidelines in place. He added that many residents of the community are slipping across the border to Brazil for various reasons. However, Dr. Uthma, in clearing the air, explained that not all the cases were imported from Brazilians, but from residents who visited Brazil recently and became infected. A number of females who interacted with Brazilian minors also became infected with the disease. He called on residents to adhere to the guidelines set in place for their continued safety and protection. Meanwhile, a resident of Lethem and former member of parliament in the region, Alistair Charlie, reiterated calls for stricter monitoring of the indigenous communities at the borders of Brazil. He expressed outrage that residents are still crossing the borders to purchase necessities, despite the region being on lockdown. Charlie added that most village councils have implemented a system to limit the amount of unauthorized travel within the region.
It will not be an easy access into a village unless you go with a proven medical paper from the Lethem hospital to enter the village, and for what purpose? That'll be tested before you go. That is a measure the village councils implemented.
As of Monday, Guyana currently has 218 active COVID-19 cases. For the HGP Nightly News, Amel Griffith.